This is diaphragmatic breathing, a description of what it is and how to do it. Diaphragmatic breathing is also called belly breathing, because when we're breathing diaphragmatically, what you notice is that the belly is moving more than the chest. If you're not breathing diaphragmatically, you're breathing thoracically. You're using muscles in your shoulders to help expand the rib cage, and the diaphragm is not working as it should. When you're breathing thoracically or up in your chest, you are using extra effort. It's more tiring. You're also not getting oxygen into the lower lobes of the lungs. If you can breathe diaphragmatically, you can turn around the stress response and help to calm your mind and body. So the first thing for breathing diaphragmatically is to find a comfortable position, and I encourage you to start lying down if you can, so that there's more room for the breath to move. After that, you might want to use your breathing practice, just sitting somewhere where you can lean back and have support behind your head, neck, and shoulders, so those muscles can relax completely. But for now, find a comfortable position and unloosen any tight clothing, particularly around the mid-range, a belt, a button, so that the belly can relax and move as easily as possible. And now put one hand on your chest and one hand on your belly. Now start without trying to breathe a particular way. Just notice how you're breathing right now. Which one is moving the most? The hand on your chest or the hand on your belly? And now what I want you to do is to allow yourself to exhale a little more completely as you exhale. And that will help the breath to inhale more deeply and fully into the belly. The belly may not be moving very much, and it may feel like you have to actually sort of push the belly out as you inhale. Go ahead for a moment. And just imagine you're blowing up a balloon that is not in your chest, it's actually in your belly. You're not bringing air into your belly, but this image is quite helpful because it feels that way. There's a lot of movement in your belly because as the diaphragm goes down, the belly goes out. If you're tense in your diaphragmatic region, then this will be difficult for a while. So if that's the case, you might want to practice this frequently, lying down and put something on your belly. Might be a phone book, something with a little bit of weight that'll stay there. And you can watch it, and you can practice moving it more and more completely. And now focus your attention right on your breath. Feeling the sensation of the inhale, I'm going to ask you to inhale completely and then focus on the sensations of the exhale and let that extend itself just a little bit more than you normally would. So you exhale and then you exhale a little bit more. When you follow the guided instructions, I'll be asking you to breathe in to the count of 4 and breathe out to the count of 6. This will also help to calm the autonomic nervous system. Now you can breathe ideally in and out your nose or in your nose and out your mouth. If breathing in and out of your nose is painful or difficult, perhaps because you have some sinus issues, then breathing out your mouth is okay. It's not ideal, and over time it may get easier as you feel more relaxed with your breath. It may get easier to breathe in and out of your nose. So as you follow the guided instructions, the last button on this particular application, Continue to breathe in this way. And also during the day, just check in. Put your hand on your belly. Just see how you're breathing. Are you breathing diaphragmatically? And can you, in that moment, wherever you are, bring in a big breath into the belly and let it go. If this is still difficult for you after several times of using this particular guided instruction, then try it on all fours, kneeling down on all fours, because your shoulders will be engaged and then the breath will have to come into the diaphragm. It's not the most easy way to relax, but it might be a good way to get a feeling for what diaphragmatic breathing is like. So now you're ready to do the next instruction, knowing that it'll take between 5 and 7 minutes, and you want to be sure you have that much uninterrupted time before you follow through with it.